Will we develop an intelligence? Well, if we develop an intelligence, it won't have, at least initially, the power to reproduce itself, but it might someday. We may be able, our computer system may be able to control factories. They're going to make more computer systems and maybe more software systems. Actually, software engineers are now using computers to design their computer programs. So it is conceivable in the distant future, maybe even in our children's lifetime, that computers will design themselves and they'll be essentially alive. They'll be able to make incremental improvements and make more of themselves. And if they do, it's another form of life. Now, is that the worst thing that ever happened? Well, for humans, you and I, it may not be the best. Is it the worst in the scheme of the universe? Maybe. Maybe it's already happened somewhere. Maybe we'll encounter some of these robotic intelligences. Maybe they'll be far more intelligent and understanding than we are. Those are things that may happen in the distant future. But what you should be aware of now is what's happening right now. It's been going on for a long time. It's caused major social and political disruptions as people lose jobs, lose incomes, gain jobs, gain incomes. Different populations have different skills. It's a wildly changing world. The narrow world that we look at, which is healthcare, is going to get more efficient. It's going to be transformed. More people will be able to have access to high quality care. The overall care will improve, I believe. Your patient experience will improve. Your ability to help your own health will improve. So those are all positives. But every positive has its negatives. And there will be negatives that we experience with high power computation today. Those are some general thoughts for this morning about AI. I'm welcome to take some comments. Kim, you often have a different point of view. You're looking at how AI is used for right now by ophthalmologists. What are your thoughts on this?
So I've done a variety of different things with AI in the field of health. It was part of one of the things that I studied for the capstone of my master's. And one thing that I think gets overlooked a lot is its actual applications to public health at large. One of the things that is a large part of public health is doing these like geographic kind of assessments in a way, and using geographic information systems. And we're actually now able to leverage AI's kind of machine learning and algorithms, especially in a researcher in the loop situation, or a human in the loop, which basically means that it'll learn from the human that's working alongside it and try to make things more clear. But because of those, we now can look at things and analyze disease spread or disease clusters, or even if it's something that's not communicable, we could still see kind of what's happening in certain areas. So maybe there is like an uptick of cancer in a certain area. Well, now we have AI that's going to help us look at those demographics, those health records, those environmental factors, and help us forecast all of these things like spread to different people or the high risk population, so we can make more targeted interventions. And another aspect of AI for public health in general that also a lot of people don't think about, which could also be used by all researchers, not even just public health, but AI can now help with literature review by helping scan stories and learn more, so it can help you process more information faster in a way that then you can actually use it practically. So I think it's nice to have AI to do some of the stuff that felt like very heavy lifting when it comes to public health and interventions and research, while we still have those with that expertise, like Griffin was mentioning, actually being the ones that are interacting with this information or interfacing with it, with the AI itself, in order to actually make something useful or something that can kind of benefit the community at large. There is a group out of California at the University of California that used all these new models to actually predict the spread of wildfires and then how that's impacting the public health of the communities that are closest to those predicted spread areas. And so it's already being used in a public health setting. I'm very curious to see where it goes. And I know there's a lot of people that are a little bit like unsure of how far to take it and when is it too far with data analysis and applying these things, and at what point do we take the human out of the loop and those sorts of things. So it'll definitely be interesting to see it continue to kind of grow in a way and see how the machine learning itself, the new algorithms, the new natural language processing systems, how those all tie together to make kind of essentially a new type of healthcare, a new type of medicine.
One of the things I think that, and thank you, Kim, that was great. Kim's an epidemiologist, and I think one of the areas that I really didn't talk much about, just touched on with the genomic work, is the importance that she's emphasized of being able to look at large amounts of data and make correlations and try to make sense out of that. A correlation isn't causation, that's what we learn, but in public health, it's certainly important. And I think one of the key uses of AI is going to be in the field of public health and epidemiology, where you look at very large populations that you really need the power of AI. And the other thing you mentioned, Kim, that I think is important is if you're a researcher, you now have information at your fingertips, which you just didn't have before. We had it with Wikipedia and those systems, but now we have it in much more real time, in a much more granular way. We can really look at the edges of like side effects for drugs. So we can look at literature that many people may have forgotten and pull up. And many of these systems prompt you to continue to ask questions. And the best of the systems now, some of the ones that we use, provide the actual reference to the point that they've made. And a lot of times, if you ask a simple question, they'll give you an answer. And you say, I'm not sure that's entirely right. Have you overlooked this? And the answer will come, yes, that is a rare effect. I overlooked it because it wasn't my primary interest, but it is a rare effect that if you're really interested in that, you have to go and push the system to answer it. To find the answer if you already have an inkling of what the answer might be. However, if you don't have an inkling of what the answer might be, you might overlook it altogether. So I think that there are pluses and minuses with the way these systems work, but I think your comment on the use of this for public health and epidemiology is really important. Roberto, you use these very powerful systems all the time to look at comparative nucleic acid and protein structures. What are your thoughts?
Yeah, and they're very useful. On the other hand, they have the limitation, and I think that applies to all these systems, of data collection. For instance, you saw in the SARS-CoV-2 epidemic how viruses were being sequenced around the world, yet the sequences are not perfect, and they're missing whole regions of the genome. So it's hard to interpret, and that limitation applies to hospital systems too, is how do you collect data? Beyond what is linked to reimbursement and payment, which is what is truly at the end being collected, is collecting data on humans. And I think there is that element of, I'm going to call it chaos, of human chaos, where we have trouble collecting data, we have trouble interconnecting our systems, we have trouble making sense of things. Machine learning has been around for a long time. I have friends in cardiology who are using it to interpret the images. For instance, when you have a coronary artery with a block, and do you really need the intervention, or can you get away or benefit more from just having medical therapy, or do you actually need surgery? And so you can run these kind of studies, and they've been running it for years. And it truly is very promising, but thus far hasn't changed the practice of medicine, or hasn't replaced the expertise of the operators who perform these procedures. So, and it's also in part because we don't have enough information on the patients. You can have the gender, the age, the weight, the usual information you may collect in a physical exam, but there's so many other factors we don't know about. And also, when you're trying to implement AI, even if AI learns from a limited data set, it's limited by that because not every human being is going to be the same. And I think that's also for all those arguments of the doom scenarios, is that we always have mutants. You have all the sci-fi movies showing you how we can evade these systems, and we're chaotic in nature, and we're not well organized. We have a lot of biases, and those biases are also reflected in what we feed into our AI systems. And so if you read AI interpretations in the US, you're going to get very different ones than what you get in China, because for instance, and you just need to turn on a TV and listens to the news in one country and those in another country, and you're going to get very different takes on the same story. So there is that element that is going to prevail and has been a great limitation in truly getting the benefit of all the data we have and all the opportunities we have. And
Yeah, I'd say humans. I think your point is very well taken, especially in medicine, is we don't have enough information about the lifestyle, where they're born, how they've been raised, what their income is, where they work, what are the drugs they take. I mean, and chaos is built in. There is AI for the physical world. For example, I was talking just the other day with an AI developer, and his point was a really interesting one, is that most of the current AI systems are merely collecting a lot of data, and a lot of it may be flowed from humans. But let's say if you're looking at drugs or protein interactions, and if you're looking at AlphaFold, which allows you to predict proteins, that's basically AI, which is looking at what has happened and likely what should happen given a person relative situation. There's another way of looking at it altogether, which is we may be able to get enough information about the molecular orbitals of each of the components of that protein and understand how they're going to interact with other things. So you can start to use first principles of atomic structure, subatomic structure, to make physical predictions. And those aren't going to be limited by human chaos. And so that's also a very interesting idea, is there's a completely different way of looking at, say, protein drug interaction, rather than saying what has happened based on massive amounts of data, various variable quality. Look at something much more intrinsic and predict from first principles what's likely to happen. It may be harder, but computers are not getting there.
I'll give you an example in the real world with antibiotic resistance, for instance, and how hospital systems have tried to minimize it. And you have an incredible disconnect, say, between the ambulance system, the hospital system, the outpatient clinic system, the nursing homes, et cetera. So there have been systems who have tried to bring all of that together, because to really help a patient and help control antibiotic resistance, you need to understand the prescriptions patterns and who is prescribing and the compliance of the patient and so forth and so on. And some systems have been relatively successful at gaining, but you have to have a system that controls all the aspects of, yeah. And so it has been hard, and it requires a lot of money and a lot of human resources and so forth. And also, if you're trying to, like you were saying with causing harm in medical devices, if you can hack into someone's defibrillator or pacemaker, you can kill the person. And that has happened. And we see how every day we get hacked and we get, and another aspect is long-term, is you were talking about acute results in the New York University example and so forth, but the real question is, I'm the government and I have a limited amount of money to invest in cancer and vaccines and all the areas. I want to know what is really worth it in the long run to improve quality of life and to decrease mortality, which are the main endpoints of why we do medicine, is to make our lives better and to help us live longer. We don't have that long-term follow-up.
Let me just give you an example of that, Roberto, that's come up recently, and that is colonoscopy. There are huge recommendations to have colonoscopies. Doesn't really make a difference. And there are now serious questions of whether a colonoscopy is going to make a difference to your life. Not your colon cancer health, your life. And I think it's coming to the point where people are deciding not to. The same thing happened with breast cancer screening. Big questions about when and who should be subject to X-ray examination or for breast cancer screening. So those are just current examples of what a government has to look at. And AI should help that decision. Will that help? But then there's a question, will that help for everybody? Or will that only help for some people? Comment?
Well, we'll have to do, for instance, autopsies on everybody who dies. And I remember one of my pathology professors, he was very much into that. And I believe that because let's say when we were able to scan the whole body, and then people are like, oh, great, you know, I can check my status every year. But you find a lot of little masses and things that are innocuous, but we don't know what's benign and what's malignant. And so if we get the autopsies and say, well, this person had this medical history, and this wasn't what killed that person or made them sick. So we need that kind of information then to feed into what we should really do or not. And then take the money out of the equation because it's constantly there. And there's always that bias of what makes money and what doesn't make money. And it's a natural human tendency.
It's about cost of government that or what causes access. I mean, every system has its positives and negatives.
Yeah, and in medicine, you work out of paradigms and protocols. But if it were that simple, you can have robots be physicians. It's not that simple. And a human being, you know, you may be now at a certain stage. Someone dies in your family and you're in bereavement. That changed your entire body and your level of inflammation and all of this. We don't know enough of what defines health and what defines illness and what are the different variations of health and the different variations of illness to really, you know, control all of that. But it's great.
And team, we're getting near the end of the hour. But what I'd like to say is, it's clear that increased computation has and is continuing to change our life. It will change our medical life as well as other aspects of our life. It's something we all have to be aware of. We can be aware of the positives, we'd be aware of the negatives. We also have to be aware of the hype that this is going to change us very quickly and change everybody. Sometimes it might, and sometimes it might not. But at least we've got some of the issues of what's happening on the table and some of the positives and negatives and some of the real expectations. I want to thank you all for your discussion today. Thanks a lot. That's all for an hour this morning of a topic that's worth and is receiving hours and hours of commentary around the world. Thank you very much.